The world's best physios don't just treat, they coach. Here at the Physio Coach Podcast, we invite the best physios, coaches, and health experts to inspire you on your journey to becoming a physio coach. This podcast is sponsored by Better, provider of in-person physio and personal training services in central London. We help people feel better, then live better. We believe that better never ends. This podcast exists to inspire your journey to better. Good questions open conversations. Good questions lead to good answers. Good questions lead to understanding a person's viewpoint. Today's episode is about questions. We're back with Dr. Steve Mayers, who is a previous guest on this podcast. I'd encourage all listeners that haven't picked up that episode to get that episode either in before this one or after is fine. It doesn't matter which way around, because they're going to be quite different. So last time was about diagnosis and understanding different diagnoses and therapy culture. We covered a bit of that as well. But this episode is very specifically about questions. This seems to fit really well with our rebrand. Our rebrand is the Physio Coach Podcast. And the physio coach needs to be able to ask good questions in order to coach appropriately and effectively and get good outcomes. Motivational interviewing is fairly common knowledge now as a way of asking questions. Motivational interviewing has been, I remember being taught this when I was maybe 2 or 3 years qualified, perhaps almost a little too new to truly understand it. But actually there's always been something that's not quite sat right with me around it, and I want to bring you in here, Steve, and if you help me understand this in our prep time about what wasn't quite right about it for some situations. So thanks for coming back. Tell us a bit more about your thoughts on motivational interviewing and then lead us into questions.
Yeah, thanks for having me. Yeah, many thoughts. I guess maybe it might be useful for me to caveat it and saying that I guess I'm coming at this from two positions. One is I think my job is to find out how to ask the right sort of questions and when to and not to, find the cadence of that. And the other thing is, as someone who's been an athlete for years in different ways, I've had, I would say, thousands of hours of physio managing injuries and stuff. So I have some experience of not just questioning as a psychologist, but being questioned as a patient, which might be helpful for people to kind of think about. When I think about motivational interviewing, or MI as it's sometimes abbreviated to, usually I think of Socrates, who's a Greek philosopher. He died 400 years BC, thereabouts. And he had an approach to engaging with people that was a little bit different than had come before, and he kind of became renowned for that. Sometimes he irritated people, because usually when they would ask him a question, he would then follow up with a question, which I think stereotypically, when I was thinking about that, is often what people attribute to what psychologists do. You know, if you ask them a question, they'll just ask you why it's important for you to ask that question or something like that, which can be a bit frustrating for people. But the aim, I think, of Socrates was to allow people to come to their own conclusion about what was true, or what they were the question that they were trying to understand, so that he didn't just deliver the message through his wisdom, but they discovered it themselves and had a different sort of experience of that discovery. And motivational interviewing, which kind of in my training was mostly emphasized in the context of drug and alcohol dependence, is similar in that way. It doesn't look to say to somebody, hey, we know what you need to do. You need to abstain or change your habits around these sorts of things. Because most of the time when people come to get support, they already know that. It's not about knowing that will facilitate the change. So the efforts of the interviewer, therapist, or the person providing support in the context of drug and alcohol is to help somebody understand their own experience and motivations more, so that they can have some self-generated awareness of what might be useful to do differently. And I often say to people when they come to therapy, because sometimes they'll say, oh, like, what's your advice? And I'm always hesitant around that, because I don't think the role of a psychologist is to provide advice. I think it's to help somebody discover what's meaningful to them, because there is lots of advice around. I mean, these contexts of podcasts provide lots of advice, YouTube videos, so there's loads of information online, but the process of working with somebody to cultivate self-discovery, I think, is something that's different, valuable, and at the core of what motivational interviewing tries to do.
I think it's at the heart of good coaching as well, and this is where all these different professions are more similar than they are different. You know, a good coach is trying to facilitate someone's self-discovery towards a goal they're trying to achieve, towards improving upon themselves. So it's clear that there are so many things that we can learn from different people in different professions. And when we first started talking about an alternative episode to the previous one, we had this idea of flipping it, and you would ask me the questions, and you would almost treat me as a client for a little while, and we're going to get that to that at the end of the episode. We're going to then see what it's like in action, or listen to what it's like in action. But in order to set that up, we want to explore this idea a little more deeply about asking good questions. It's at the heart of good coaching, good psychology, good physio. I think it's right at the heart of that. So how did you become so interested in it? Was it just a case of your training and your profession, or is there something a little deeper than that really got you curious about questions?
I think it probably was during my experience of training, and maybe growing up and feeling like there was only a couple of ways to interact or deal with situations or make sense of the world. I mean, psychology, I think, offers us ways to understand and find language for things that previously we didn't have words for. So as I went through my training, I started to see different approaches that seemed a bit more prescriptive or descriptive, which I was kind of like, that doesn't seem like the right sort of way to meet with somebody. Or I'd go and try something in therapy, and then I'd be like, oh, that kind of, it doesn't feel like it's representative of how I should work. And I guess that's something we'll talk a bit more about this idea of how you cultivate your own style of being in your work, because I think that's really important in this. So I, over time, worked with kind of different ideas in mind. And I suppose some of the things that we might usefully cover today, thinking about, in some ways, like the history of some ideas in psychotherapy. We could talk a bit about how psychoanalysis was initially. We could talk about some of the ideas related to Rogerian counseling, and active listening, which is part of that. And then the model that I did a lot of work in Australia, which is open dialogue, which had an appreciative stance to listening. So I think those three give us a kind of useful foundation for some ways to kind of frame things, along with some other ideas.
Let's use that as our launch pad. Let's go through those three, and then I'm sure that will lead us. And what we're encouraging here is for the listener to appreciate these things and try to implement them, and then find their own style within it. I think that's a very good point to make, is that motivational interviewing, when I first learned it 12, 13 years ago, it didn't fully embed within my practice, but it definitely got me thinking of asking better questions in different ways. So I wasn't ready to fully use it, but it certainly helped. So that's what this conversation should be about for the listener, is what's the bit that grabs you and changes practice from now. So let's use those three areas to explore. Yeah,
that sounds good. I guess one of the things that might be useful for the listeners at this point, before I go into those three different areas, is to think there's two kind of models of change and awareness that I think run through all of this, and might be useful if people haven't heard of them before to go and have a quick Google about. One of them is about stages of change, and one of them is about development of competence. And so stages of change links in because that's part of how motivational interviewing works. It thinks about where somebody is at in the stages of change. So if I get this right, there's something about a pre-contemplation stage, then contemplation, then action, planning, action, maintenance, and then continuity or discontinuity of the thing. And that cycle kind of goes on and on. And I found that quite helpful. Like, my sense is that when somebody comes for help, they're usually past the pre-contemplation stage, at least for seeking help, but they might not be past the pre-contemplation stage for actually doing something about it. So I imagine, similar to in the work that I do, if you set somebody things to do, they might not do it and they might come back. And so in some ways it might be that they're still in the contemplation stage about whether or not I want to actually commit to this, to getting better. And there are lots of reasons why that might or might not happen.
Yeah, I fully see my role in the first session, perhaps even the first 2 or 3 sessions, is encouraging them towards action, is facilitating their change towards action. And that is usually around creating a plan that's meaningful to them, finding what's important to them, using some level of metric to help them reflect upon their current situation and understand that change is even more important than they thought. And if I can facilitate behavior change through the way that I conduct my session, through the plan that I set, then then they act upon it, I know that the results are way better. So it's the same, no doubt, in your cases.
Yeah, 100%. Yeah, exactly. If it comes from the person, or they've kind of have buy-in to that. The other kind of model that really resonates is one of stages of competence. I don't know if this is familiar or not, again, to you listeners. There's something about when we try something new, we're always unconsciously incompetent. We don't know how bad we are at the thing. And then we become aware how bad we are. So we become consciously incompetent. And then eventually we become unconsciously competent. We can do the thing, but it takes a lot of effort. And then over time, we become unconsciously competent. So we can do it without even trying. And so I guess in my mind, that would work in multiple ways. Like in some ways, one could think of if you give an exercise prescription to somebody, or they're undertaking a new part of their rehab program, amongst other things. I'm sorry if I'm oversimplifying your role, because I know it's more than that.
No, it makes a lot of sense.
Yeah. Okay.
Let me see if I understand it, and you can tell me, because I think I do get what you're saying here. I have heard that framework before, but perhaps I haven't linked it to exercise prescription, and then suddenly you said it's like, oh yeah, I do that a lot. So part of our common assessment is to watch someone move. So let's use a single leg sit to stand, for example. So you have a look at them do a single leg sit to stand. Most people who haven't been aware of movement or haven't done much training before, they're not very good at it. So they tend to dominate by bending their knee and not flexing through their hips. They don't hip hinge so much. Their knee tends to drift inwards into like a valgus movement, and they don't know that that's a problem. And then you might have to say, oh, by the way, did you know that, let's say it's on one side and not the other, did you know that your knee's drifting in? Did you know that you don't push back on your hips? And then they see it in the mirror and they go, wow, I did not know I was doing that. So they then become consciously incompetent. And then the role of the rehab program is for them to use feedback to then develop the skill set of being able to do that movement. Quite often they have to do it quite a lot, so I get them doing it every day so they learn fast. I get them doing it with a mirror to begin with, and then take away the mirror so they can learn the skill intrinsically rather than kind of using the feedback. So they then become consciously competent, so they're having to be conscious and think about it, but they're competent. And then with time it becomes an automatic movement pattern, and they don't have to think about it anymore, unconsciously competent. So I completely get that, and I think that makes a lot of sense in the way that we often help someone learn a movement skill.
Yeah, I really like that example. I think that's exactly it. And that pattern probably replays over and over in our lives all the time. And maybe in thinking about what we're talking about today, there's something about developing a style of questioning that would go through those stages too. So I guess if the listeners hear of things where they're like, oh, I kind of like that idea, then they might become aware that they have been questioning in a way that kind of didn't feel right, and they want to do something differently. And then there's an opportunity to kind of develop that further. I suppose my sense is that a lot of the time, I'll say clinicians, because having worked in MDTs, it's not like I think that one clinical group does it better than others. And, this is with medics in mind too. I think oftentimes people become aware that there are different ways to communicate, but becoming settled in and comfortable in like, okay, this is how I do it. I don't know if everybody kind of gets there, and it will often feel like people, like what I've witnessed is people kind of move in between, like, okay, I'm doing this now, and now I'm doing this, which I think can sometimes jar for patients or people who are accessing support. So I don't know how to solve that, but I think it's a thing, and I think it can be different.
I still think that's important for people to consider. It might be worth it to keep trying to move between these different frameworks and different ways of asking questions, different ways of being, because they're still discovering what really works, what's most effective. This kind of iterative process. I'm going to put this into my practice and see if it sticks, see if it works for me, see if it feels authentic for me. there was a period in my clinical career, and it wasn't even that early, this is probably through the middle of my career, where I had a very specific framework as to how I would structure my first session. And it wasn't that I would follow those questions or those sections exactly as I'd written them, but they were there to prompt me so that I didn't miss anything that I felt was important. And I felt fluid in the moment, and I felt like I was able to be reactive to the person. But there was still an element of like, I must ask that, I must make sure I ask that. And there's physios out there will be saying, there are still really important questions we have to ask everyone, and that's true. But there comes a time, and I'm probably there now in the last few years, where I don't need that structure anymore. I'm able to be much more in the moment, still cover those questions because I'm not conscious of those questions anymore. I'm unconsciously asking them, checking them off without checking my structure. So I would say I've arrived at a point where I'm reasonably good at that. I'm still very curious. I think you could teach me a lot about asking questions here, but I know I have my flow that seems to work, and I'm not thinking about my questions. I'm just in the flow and in the moment, trying to be present.
Yeah, that resonates. Like, it makes me think back to early days as well, and feeling like if I didn't have the sheet that told me what I needed to ask, then I'd feel lost. In some ways, some of the models of psychotherapy are quite strict on not having paper with you, because it kind of gets in the way of the relationship. And during clinical training, I was a little bit in at the deep end in one model, which was very much based on helping somebody connect with where they're at and what's going on, and figuring out what the problem is straight away. And so without that, I was kind of given not much structure, just an aim. And I guess I kind of dove in at the deep end. Took quite a while actually. I'd say it's still an ongoing process, really, of like thinking about what the right sorts of things to ask are to who, because it might be different for each person as well, which is complicated. But I think just the way it is, not everybody needs the same approach.
I've started to use AI. I've used Heidi, which is a healthcare AI system that is listening to the conversation and writing my notes for me at the end. I'd say there's about a 95% of my notes are then written, and I'll check back through it and add bits that it hasn't quite picked up on. I'm having to get better at saying out loud my assessment findings rather than just doing them, so that it's picking those things up. But it's allowed me to be much more present in the moment and give the person my undivided attention. I used to be quite diligent with writing notes. I didn't want to miss details that I felt were important. In some ways, it felt almost like my clinical reasoning process was just as much about me writing this stuff down as it was about me hearing it. The writing was part of my thinking.
Yeah.
But it was liberating to step away from that process, actually, and just to be more in the moment, to listen and realize that I could still have that clinical reasoning process without the writing.
Yeah.
How do you feel about that? How do you feel that would align with the work that you do using AI as a notes writer?
Yeah, it's an interesting one at the moment, isn't it? Because I've played around with some of these apps, and I had the same experience perhaps that you described, which is that because I don't write notes during sessions anyway, it was making things a little bit easier, because afterwards I wouldn't have to go and trawl through my mind and recount the conversation, think about moments of resonance, what seemed most important, and broadly think about what my future self might want to know about what I've made sense of now. But I did also find that in not doing that, I was kind of missing part of the process for me. Because I think as you said, like, writing helps us think. And if you aren't doing that yourself, then it's kind of, it's incomplete, or there's not some consolidation or something that happens in that. I also find that, like, after sessions, when I think about the conversation that we've had, that's often where I find myself wondering a little bit more. And so this is my kind of gripe with AI, is that potentially it's making us all less intelligent and less capable in ways that we really wouldn't want to be. And it's not doing the tasks that we would like it to do, like, I don't know, cleaning up, or, making some of the more mundane tasks of life easier. It's kind of taking away the exciting, engaging parts. So I have reservation, and I'm not using it too much at the moment for those reasons.
I found that when I'm reading back through the notes, this is almost a counter to your point there, is that there are bits that I've missed, actually, and there's bits that I'm thinking, I don't remember that. That's really useful to have read back through, because I didn't hear that in the moment. There's there's also where I know that I do need to some degree, I hope it always stays slightly inaccurate so that I do always have to read it. Because when I do read through it, that's my consolidation process, I think.
Okay.
That's really interesting to hear your feedback, though, because I can imagine that other people out there will be thinking the same thing, that contemplation stage after the session is really valuable for them.
Yeah.
And that maybe the AI is taking away that process. Yeah, super interesting. I think you could easily argue both ends there, and it probably is up to the individual to figure out for themselves what works best.
Yeah, it would be interesting because, I mean, in the future, if I watch this video back and people have written what their perspectives are, I would be really interested to read more about that, because at the moment I'm, as you probably are, thinking about it quite a lot.
Yeah.
I guess one of the other things, and maybe this takes us back to those models that I said I'd talk about, the Rogerian style, the appreciative listening, and the early psychoanalytic approach. There is a question at the moment about if AI does therapy, what is it doing? Because it's, don't know how many conversations you've had with ChatGPT, but it's a very affirmatory process. It responds quickly. There's no silence. There's no challenge in the question. And it's very much like, hey, like, seems like what you're saying is totally understandable given what's happening to you. And I guess one of the concerns that people often have about therapy is that it's only a process that affirms an individual, and it doesn't actually support the larger societal good. So yeah, I don't think it does therapy very well. I don't think it does conversations very well. It's good at asking more, but it doesn't challenge, and it doesn't allow space. And maybe through talking about some of these different ways, it might help us to kind of figure out how all that fits together. Because I guess AI eventually will ask questions in all sorts of disciplines on our behalf, perhaps. We send somebody in with a chatbot for 10 minutes and then, you come in and do the physio side of things. I don't know.
I do believe that some of the low-skilled work will be taken. I think that's pretty clear now, that simple clinical reasoning can be done by AI. I think that the coach will be able to connect with the person on a human level, that it will still continue to be valuable. People will still want the experience of working with a person on the whole, I believe. So those that are good at working with people, that are good at connecting, that are good at creating an experience around that's positive and inspirational, I think will thrive and continue to be at the top of the profession. But I do worry that people that don't have that growth mindset, that don't continue to develop their communication skill, develop their connection, develop their expertise, that can inspire people towards making big change in their life. I think those people might struggle, and they might get left behind and be overtaken by AI.
Yeah.
So that's part of what drives me on, is to keep helping. A rising tide lifts all ships, right? So to keep rising the tide of quality within the physio community, so that everyone improves and keeps hold of their job and enjoys what they do and changes lives and inspires health change. So that's where I get my motivation from.
Yeah. I think, so I guess we've already spoke a bit about MI and Socrates, and I've mentioned a couple of times that I'll talk about these things, so I'll talk about it now. I mean, it's maybe a bit of a whistle-stop tour of how I understand some of these ideas, but Freud is really considered the godfather of psychotherapy in some ways, because he was medically trained, which is why he had people lie on a couch, because he was used to examining the head. But the idea of a talking cure kind of came at the end of the 19th century through the work that Freud was doing. He wasn't the first to do it or think about it, and people have been having conversations for a long time and feeling better. But what he noticed was that in largely wealthy Viennese women, that their experience of talking about things and making associations between certain things that were happening in their life experiences, their unconscious mind through their dreams, gave them relief from their suffering. And that he was an incredible thinker and had lots of ideas, and some of them were controversial, which means often he gets discredited, but he kind of laid the foundation for the idea that asking questions in the right sort of way can lead to somebody having a lot of relief. Although I guess ironically, in some ways, the role of the psychoanalyst isn't always to ask questions. It was maybe a more passive position. Their idea was that the therapist is a blank slate, so they would support the associations that might happen. but the questioning was very different to how I might practice and how modern psychotherapy often happens. And over the early part of the 20th century, there was lots of psychoanalysts and different ways of practicing, different thinkers that were known and people were following in the footsteps of. But at the end of World War II, there were lots of people who came back from the war who were having real issues with their mental health, and we needed another way to meet with people that was less time intensive. Sometimes psychoanalytic psychotherapy involves meeting multiple times a week for a period of years, which, as I guess most people, if they heard that, might think that's very different to what modern psychotherapy is. And that's where ideas from behaviorism and cognitive theory eventually led to CBT. And there are so many threads in this, but one of the other threads of interest is Carl Rogers and his approach to psychotherapy, which was a much more active but heavily person-centered model of therapy, very much based on unconditional positive regard for the other. So there was no judgment from the therapist. And his efforts were to understand with somebody about what was happening. And so one of the techniques that we took from his approach was this idea of active listening, where you tell me something about your experience and then I kind of give it back to you, but in a way that's a little bit different to how you said it, maybe with some of my understanding on it. Kind of a little bit like what we did earlier on when you said, okay, let me think about these levels of competence. Like, is this how I understand it? If you were doing that to be like, hey, Steve, like, is this what you mean a little bit more directly? That would be a very active listening kind of approach. And that idea has kind of dominated modern psychology in my experience. Most of the models have some element of that in it. But there are more kind of like postmodern approaches. And as I mentioned, the open dialogue model, which came from Finland and was based on lots of kind of different ideas, I guess, about what it is to meet somebody experiencing distress, had a different approach to listening, which was about appreciative listening. And although I'm talking about listening and this is about questions, the way that we listen, I think, informs the way that we question. So in active listening, you might reframe something to somebody and then you might inquire more on the back of that. So like, what would that mean in relation to this? And you start to join things together and interpret. From an appreciative stance, you might just be with somebody and just inquire more. Someone says a word and you say, oh, this word, and then they give you a bit more, and then they talk in another way, and then you say, oh, and you mentioned this, and you just allow them to move into their own thinking more and more without your intervention as a person in the room. And that kind of means that the listening becomes the question, because if you just feed a word back with a question mark and an intonation at the end, you kind of are asking in a very like minimalist way. Might be one way to think about it, although I've not described it like that before, but I guess that kind of makes sense in my mind.
That surprisingly feels, without me expecting that to be what I do, that sounds very much like some of the questioning that I would lean towards. Certainly active listening, certainly picking up on words and adding that little kind of question mark, minimalist question mark at the end, encouraging them to reflect upon that word and what it might mean.
Yeah.
Interesting.
Yeah, I guess it's a kind of, it is also an active position of yourself, because you need to be there and be present, right? But yeah, what you put forward is more, appreciating what the person brings rather than trying to interpret or shift it a little bit. And I think sometimes the challenge is finding when it's most useful to move between those. When we were thinking about coming today, there were a couple of things in my mind, like ideas that I've kind of grappled with over time or thought about some more. One of them is the idea of approach versus technique. Like in my mind, I think about, there are technical aspects to the models of therapy, as I know there are technical aspects to your work in different ways, but in some ways that is separate from your approach to the person. And I think where the right sorts of questions come in maybe are in some of the approach, but they also might be in the technique. So like, I guess in my mind, when people say they're coming for therapy and they say, what do you do? I say, well, it's fundamentally a person-centered process. So we're here to figure out together what's most useful to do for you. But in that, I have some ideas from different models of therapy that might be helpful. And so we'll decide kind of what techniques we use. But that kind of like compartmentalization of those two aspects of the experience have helped me to find places to put these different ways of approaching things. Because when I'm thinking about my approach, I might be more appreciative and more kind of on the surface. But then in some techniques, it does require more direct questioning. And I think, yeah, tying those things together for me gave me permission to make sense and then do therapy in a way that fitted for me.
And then there's the really interesting contradiction of, let's use motivational interviewing here because it really resonated when you said this to me in our prep, that quite often the way that motivational interviewing ends up being is that the person who is being interviewed can feel that you know the answer, but they're trying to get you to ask the question, trying to get you to figure it out for yourself. And it's almost a bit irritating to, if you know the answer, just tell me. And when you said that, I thought, yeah, I can really buy into that. There's definitely been moments where I've been trying to ask questions. I can tell the person's just like, just tell me. And I can sense their frustration with me. Like, that's your job. Just tell me.
Yeah. I think on the back of us talking about that, it's something that comes up for me quite a lot. This idea of like, if I have something, I should let someone know. But in some ways, if you just give the answer, then maybe you're doing a disservice to the question and process. And I guess a way to manage that is this idea of sharing the dilemma. Again, it's something I picked up during training up in Leeds, which was, it kind of runs central through the course process, sharing the dilemma and genuine curiosity, which I can also talk about. But sharing the dilemma means that you get to hover above a conversation and think about what it is that you might say. So it becomes a meta process. So you might say, I'm feeling like I can just tell you what I think here if you would like. In me asking you about it, I guess it gives you a chance to really think more about your experience of it. So I like, what would be best for us to do here? What's your sense of it? And you kind of work it out together without kind of spoiling the process by just jumping in one way or another. I found that a lot of the times this comes to be useful when I work with couples, it's definitely useful sharing the dilemma because it moves people out of the conflict situation often. And with friends, I once had a friend who, after knowing them for quite a while, maybe I'd known them for a couple of years, they told me that their son had passed away when, like, many years before. I didn't even know they had a son. And I felt this like kind of wave of like, oh, I kind of want to ask about that, but that feels so insensitive. I should have known it. And I just said to her, I feel like I want to ask you more about that, but I don't know if that's okay. And she was like, yeah, that's okay. And so that I was like, okay, that's a really useful kind of personal strategy as well, to kind of take a step back and just share our working out with somebody so that they have an opportunity to input into the process as well as be the recipient of the process.
So if you're in the moment, you can sense that there's an elephant in the room. You can sense that there's this obvious answer that's staring them in the face, but they can't see it yet. Mm-hmm. You could say, I'm feeling like I've got an idea about where we might go here. Are you happy for us to explore those ideas and see if we could come up with a good plan together? So you kind of approach it with a question again, but an inviting question to go through it as a shared experience. I've got this thing going on, and I wonder what you make of it, or if you think that's a good idea. One of the challenges with sharing the dilemma is that often people feel like they're not competent when they do that. So, people come in and they're like, hey, I'm seeing this physio and he's in the city and the offices are so nice. Like, they better know what they're doing, right? That's our assumption. And some people do come with that, and they do want us to be like, just tell me what to do. Yeah, I'm not paying you to help you do your job. Yeah. So sometimes, again, it comes back to that idea of when you move in and out of this. But I'll often share the dilemma with somebody. If I meet with them and I'm like, something doesn't feel right here, I don't know if they want to be here, then I'll often share the dilemma around that. Like, I'm kind of wondering in this conversation if this is something, how did you come to be here? Is this something you want to do? I'm not sure if it is. Like, I'm kind of curious around that, to give someone an opportunity to identify it. Because usually if you're picking up on it, given that you, and I imagine the listeners have met with like hundreds, if not thousands of people, when something's different, it probably is different. And so figuring out how to talk about that can help to move through the process differently. One of the questions that I commonly would ask someone would be, what do you think's going on with this situation? What do you think might be wrong with you at the moment? Have you got any any ideas about what structures are involved here. And it's like this expectations gathering, or what are you hoping for out of this session? Some level of expectation, belief, question. And most of the time it's quite useful when people have really good insights, and it's also giving them a chance to really explain how it feels in their body and what it feels like to them. But sometimes you get, isn't that what your job is? Isn't that why I'm here? Yeah. And they can't quite understand why you've asked them that. So most of the time my answer would be, yeah, of course, but I'm really interested in your point of view, because it's amazing how accurate people's insights can be.
Yeah.
But it doesn't always land very well. It's interesting to me.
Yeah. I guess that speaks to the genuine curiosity that's often useful in the process as well, because you've seen, in any iteration of an injury, you've probably seen something like that. And I think sometimes the challenge is to be like, okay, maybe this isn't the same as everything I've seen before. But yeah, it can be challenging to do that, and knowing when to kind of be the expert or the kind of the knower, and when to kind of share in that and give the person an opportunity to be the one who guides things. Often when I meet with people at the beginning of therapy, I'll say, and which is, I guess, a different process perhaps in some ways, because there isn't always a clear thing that somebody comes with. I'll often be like, what's most important to talk about today, as a place to start, to give them an opportunity to contribute to, the direction and kind of where we go next. But some people are like, well, where do you want to go? Like it's kind of that same thing, like isn't this your kind of task? One of the things we know, I'd be interested in research around this from physiotherapy. I know little bits about it, but I'd be interested in your perspective. They do common factors analysis of psychotherapy and what makes it work. The two biggest contributors to effect of psychotherapy is the person's motivation and readiness to change, that harking back to that earlier model. The other one is the relationship that you have with them. And for me, the sharing is part of the relationship formation. And the asking, where are you at, what do you want, is part of keying into their readiness to change. It's not like you need the other stuff, you need the technique, but in psychotherapy, they're way less important than people think they are. Often the technique and the approach is for the therapist, not for the person accessing support. It's
the same with physio. Okay. Yeah, my understanding of the research says that the therapeutic relationship is hugely important to the success of the outcome. And it beats the technique by quite some way. My sense is that what that relationship gives, that connection gives, is an opportunity for someone to really commit to the process. There's probably some level of placebo involved there as well, where someone is believing that I'm the right person to help them, and then that's kicking off all sorts of positive healing responses within the brain. So I'm fully open to that. I think the placebo effect starts from the moment they're engaging with your online presence, from the moment they catch anything about you, that potential placebo effect has been triggered. So what's your online branding like? What do your reviews say? What does the person who's recommended you say? All of that stuff is building some level of expectation towards effect. So I'm all about facilitating that, the online branding, the messaging that comes through when they book an appointment, constantly trying to make sure that stuff is all geared towards recovery, or geared towards positive effects. So I think we shouldn't underestimate that part of our role. But yeah, in general, that connection is so important to get what you want from the outcome.
Yeah. There's an existential psychotherapist called Irvin Yalom, and he talks a lot. He's very well known in the community, and lots of people know about him generally. And he talks about the idea that if someone comes to see him for therapy, he knows that he'll be more effective because they know of him and because they've got certain ideas about who he is. Which makes me think about, I guess, as you were talking about your practice, Charlie, about like what it is that you bring to your physio. I had a supervisor once tell me that, Jung was good at what he did because he was Carl Jung and Freud in the same way, and Rogers, and my task was to be more like myself in therapy and figure out what my therapy was, which at the time I was like, that doesn't feel like the right sort of thing to do, because I was quite early on in my individual therapy practice. But over time I've really learned into that, and it gave me permission to stop trying to learn what I should do externally and trust that I had enough information to be able to do what I was doing competently and confidently. But yeah, I know it's something that came up briefly in our pre-chat about like how you become you in your work and not just a person who then delivers a role to somebody or
Yeah, because I then asked you, is it authentic to consider the clinician and consider yourself as a chameleon and to be able to blend and adapt to the person in front of you? Because I've heard people speaking of this authenticity as if there is this one version of yourself that must be true and pure, and it's just that full authentic self that is in front of that person that doesn't change, doesn't matter what that person is in front of you. My kickback to that has always been, well, I bet you don't speak to your nan in the same way you speak to your best mate, and the same way you speak to the guy who's working at the post office. I bet there's always this slightly different front that you put on in order to be appropriate and to get to build connections with people who are different. So I think thankfully you reassured me and said, yeah, you can have these different versions, different faces, different authentic selves.
Yeah, 100%. I think it's, in my mind, maybe what feels authentic is, inauthentic is a way of being that feels so far removed from the core of what we value and is important that it's like, that isn't me. But usually if I have a kind of Venn diagram in mind of like who we are and then who we are in different situations, there has to be enough overlap that wherever we are, we're hinged to the edge of our core essence of self, even if we're being a much more formal, reserved version of ourselves because of who is around, or we're being way more kind of loose and relaxed than we would usually be with another group of people. I think if the core remains the same, then it can still feel like we're being authentic. And so in my work, I spoke with a client about this yesterday. Usually people say, oh, like, what I like is that I feel like you won't bullshit me, or something along those lines. You're not like pretending. And I thought to myself, like, when I heard that's true. And also there are lots of things that I don't say. So it's not as though I need to say everything to be seen as authentic. I just need to be tethered to, I guess, my value of not being deceptive and kind of working collaboratively and being curious. It's not like, if I don't say everything, then I'm a fraud.
Yeah, that's the difference, isn't it, with like facts and truth, and it's like it depends on the person, depends on what they're willing to share. It doesn't make it false necessarily, or more true. If you say more, it's I think there is so much context attached to that.
Yeah.
So if the clinician out there is now feeling like, oh shit, I need to discover myself in order to figure out my communication style, I think there is a truth to that for sure, but there is still some level of technique that they could learn in order to figure out which bit does land for them. So what kind of techniques might you help someone learn in order to go out and try those things to see what works?
Yeah, I think there's I reckon that everybody who's listening, if they're practicing, they already have their own thing that feels like it works and things that don't quite feel right. And so in some ways the task is one of like self-reflection and kind of noticing. I guess the process that I went through was noticing what I say often and what kind of feels like the right thing to say, or what things I say and I'm like, that just isn't true, but why have I said it? And there were like multiple examples of all of those. So I'd say it could potentially be useful to have a kind of reflective process after sessions to be like, all right, like what went on there, and like thinking about the ideas that we just said, like, could I understand that as motivational interviewing? Was I grappling with their readiness to change? Is this about how comfortable I am with these different ways of being? And I guess one of the other crucial things, which harks back to, I guess, some of what we've spoken about being yourself, and was present in this model called open dialogue, was how much of yourself you share in the process. And I've seen your Instagram, so I know that you have certain things about your life and things that you do that other people know about you. And I imagine that when people meet with you, they have a sense of like, oh, that it's Charlie, rather than like maybe they say to other people, it's my physio Charlie, but when they come to see you, they're seeing you and you're a physio, I would imagine, because the relationship's important. If they keep coming back, it's because they want to come and see you as much as, get the benefit from the treatment. And so I think along with the reflecting on like, what questions do I ask? What don't I ask? How do I understand my approach of the things I want to do differently? I would encourage people to think about how much of themselves they bring and what feels like the right amount. I don't think there is a correct answer to it. But I think there is a continuum of self-disclosure, and yeah, that it's more tricky to navigate than one might assume at the offset. It's not like, again, like you just disclose everything or you don't disclose. It's kind of like when and how. And my rule on it for myself is I would never disclose something about my own experience that was unresolved. So if someone's talking about a challenge that they have and I'm like, oh, I'm actually having an argument with my girlfriend at the moment about this sort of thing, and I'm stressed about it, I would never bring that, because that would position the other as needing to support me. But if there are things that orbit my experience that feel pertinent and they come to mind, I will consider if I should share them or not with the person in order to facilitate the relationship, and because that feels like me being in the room. If that makes sense. A bit wordy, but
we hosted a live podcast recently, and it's the first one we've done, and it went really well. There was good engagement from the guests. We had lots of questions at the end. We had more people turn up than we expected. For a free event, that's quite nice because you get a lot of dropouts. So we were really pleased with it. And then the next morning we had another podcast to host, and beforehand I was thinking, oh, is that a bit of a scheduling error for me? That's quite a big 12 hours or so for me to commit to. And I also had an 8 a.m. patient the next day, and I was thinking, God, that's going to be an early start. But I pinged awake, full of energy, and I went to the session. It was someone I'd seen lots of times before, and I had such energy in me that I felt I have to share this energy and explain kind of why I'm kind of eyes are wide open and full of adrenaline. And we spent the first 5 to 10 minutes speaking about the podcast that I'd delivered the night before. And she was really excited for me, and she was really pleased to hear. Had that have been a new client, I wouldn't have done that. But because I knew her, I felt like that was appropriate to share. Like we'd already established a relationship. The energy was different because I was probably, I certainly felt different, and I'm sure I seemed different. And she seemed really pleased to hear it. She was really with me on that, and it felt very, very appropriate, very authentic for me to talk about that. But yeah, with the context of what is that situation for a new client, that would have been inappropriate because we haven't built a relationship that I could trust to spend 10 minutes talking about my podcast, because it's quite almost a selfish thing to speak about.
Yeah. That takes me back to, again, these early conversations when I was starting my therapy practice. And I remember coming out of a session, I had a conversation with somebody about Cardi B and hip hop for must have been close to 15 minutes of the hour that we had together. And I said to my supervisor, I was like, I don't think I'm doing therapy. But also that felt like the right sort of thing to do. And he was like, he's a very articulate person. And he was like, it sounds like what you were doing was servicing the foundations of your relationship. And I thought, well, that's why I like psychology. In some ways, it finds language for things that are hard to kind of put together. But I guess in some ways, given that people come to see you, given that relationships are really important in recovery from whatever injury, when you have that conversation, you're cultivating a relationship which is part of the treatment, even though it's not the thing that you might necessarily learn about as a priority during your training years.
This is one of the reasons why we made a very deliberate choice to standardize an hour for every session, because it frees us up to talk off-piste. We don't have to get straight to the point. The half an hour quick turnover insurance-based sessions are very much like we've got 2 or 3 things that we can cover today. We can cover an exercise, 2, maybe 3, or we can do some soft tissue therapy, or we can do some mobilizations, and then we're done. And then we've got to move on, and then it's the next person in, and there's this kind of real kind of conveyor belt model of care, which takes away from the opportunity to connect. I always reflected on those longer sessions I had with people occasionally in previous jobs, thinking, God, that was so enjoyable and relaxing. That was so much, we covered so much ground there. And that's why we decided that was the model for us, that works for us. Because it does free me up to speak 10 minutes about my podcast. It does free the person up to speak 10 minutes about their journey, and it does free them up to speak about the football if that's what they're into. It's just an opportunity for someone to relax into the session and for the relationship to consolidate. What was the phrase you used? I want to hear it again.
Servicing the foundations of your relationship.
Yeah. that's almost given me permission to carry on.
Yeah, that's credit to Warwick, who's my supervisor. Yeah, I think there is something about that. I wonder, so yeah, it'd be interesting how this works in physio. So often in therapy, one of the conversations when somebody returns is, what stood out to you from our last conversation? And I've often been surprised that many times the things that people have remembered or spontaneously gone back to are the things that I've shared that have personal resonance. And I might have been like, oh, I can't believe how good a job I did explaining this concept about acceptance and commitment therapy or whatever. And that like washes over. But when I told them about how sometimes in my family system, it's been a bit like how they described, even though I know it's not the same, like it's like, oh yeah, I remember you said that about, and they look for the moments of connection as facilitative in the process. And they're the things that stand out more than, oh, like, yeah, you did like really great, exercise prescription.
I do this all the time. Yeah, I fully believe that if we are better physios, and perhaps actually what you're saying is we are, people connect better with us when they sense that we have been through that process ourselves. So I've had ankle surgery, I've had back surgery. When I'm speaking about those two things with someone in front of me, they seem to connect with my experience, even though N=1 isn't the most accurate of evidence base or powerful of evidence base. It really does connect with the person. They're learning through story, they're learning through connection with you. He's been through this he must know how to treat this as well. So yeah, there's certainly something in that.
Yeah, that makes me think actually about, if people want to develop their technique, one of the useful things that you can do, well, you can ask people, you can say, how was it when you met with me? Is there anything I could have done different? And that is not always an easy question to ask in the moment, especially if you like that didn't go well, because you're so vulnerable, right? For them to be like, actually, I don't rate you as a clinician or whatever. The other thing is like when you start talking with somebody, especially if they're new, notice what happens as you talk. So it's but not that easy to do, but be the person who's speaking and be the observer of the conversation, and notice the moment when they put their keys down because they've relaxed, or when they kind of take a side, or when they seem to settle in the chair, or when they catch your gaze in a different sort of way. Because those things that are happening in that moment are the things that are cultivating the relationship, I would hypothesize. I mean, it could be that some other thing is going on and someone has like a bit of a twinge in their side and they're like, oh, but usually I think when you feel those moments of settling in, they're good indicators that what you're doing at that point is a really useful thing. And as you described, like saying, I'll often say to people, having sat on your side of this process, I appreciate it's kind of weird to come and speak to someone you've never met before. And then I ask you about the most personal things within like 5 minutes. I've been in that. And even though I trained in it, it wasn't always easy. And, those sorts of things I think can be really useful.
Yeah, and the other thing I always say is that when I was in this situation, I got my own physio too. I didn't trust myself because I couldn't think rationally. So I wouldn't be surprised if some of your choices managing your current problem haven't necessarily led to any success, because it's really tough to think objectively and rationally about managing a problem which is attached to a protective system and a huge amount of emotion as well. Another thing I want to draw back to that you previously said was around that reflective question about what was it from the last session that you remember. I don't know if I do that enough in every session. I definitely do it in a lot of first follow-ups in those second sessions with someone where what is it about that first session that you remember? Have you got any reflections about that? Anything you want to speak about before we get started with today's session? But now you've said it, I feel like I should say it more often than that, rather than just in that first session, because I know the importance of repeating key points. I know the importance of helping them discover some level of clarity. Perhaps they missed what I was intending in the first session, which I think is very common, or they've forgotten it.
Yeah.
But there's no guarantee that just because I've asked it that first time, they're going to remember it the second time round. So I think it's an ongoing process of checking on the learning.
Yeah. I completely agree. Other questions that I like, I guess one of the things I've noticed when I go for physio, and I don't know how typical I am, but I usually right to the end, I'm like, oh, can you also treat this thing and this thing? And because often I like a bit of release work. And then there's not much time for kind of the wind down, and it'll often be like, okay, out of the room, see you later. And then the decompress happens afterwards. One of the things I try and do in therapy is say to people, like, because ours is conversation based, are we talking about the right sort of things and in the right sort of way? Like, is this the right sort of thing to be happening? Is this what you came here for? And I think those, again, maybe the like process based questions. Like other ones can be like, how was it to speak with me today? How have you found it being here? They just kind of check in with where someone's at, and they, again, aren't always the easiest. Sometimes, even after having asked them loads and loads of times, I find some trepidation about like, I don't know if they liked that thing that I said, or they seemed a bit zoned out when we were talking about this. And if I ask that, what if they say, actually, Steve? But it's like, if they think that it would be better if they said it, and then we can address it and repair anything that might be ruptured. Because impasse in therapy, and I guess any type of therapy, is always better repaired, because people they vote with their feet, right? If they really didn't like it, they won't come back. If they didn't like it and you try and repair it, then they might come back. And that's always better.
And I think the more curious we are, and the more in the moment we are, the more we'll pick up on whether that's the case. I do believe people, they do show things. They do make it pretty clear when they're not quite understanding, or they don't agree. There's normally some kind of facial expression or body language that they present with. Yeah. So if you're curious enough and attentive enough to those signs, you can then follow up with a clarification question, a further exploration of that. Is I can sense that you're not quite getting that, or I can sense that doesn't resonate with you. Is that right? And I can't remember the approach it's from, but the questions of I sense, it seems, it sounds like, they're quite good for checking for someone's understanding.
Yeah. I was wondering, like, am I right in thinking, or I think I'm noticing, but I'm not sure. Yeah, tentative check-ins I think are great, because it allows people to bring themselves forward and in their experience. Again, it's one of those things that probably requires a bit of balance, because sometimes people don't want you to be tentative with them. They want you to be like, right, up here, here's what we're doing. We've got 45 minutes. I'm going to blast through these points. I'm going to give you these exercises, and then off you pop, but you'll know which people require what and when, I guess, through noticing those things that we've spoken about already.
Yeah, there's another thing that you said as well, which I often do, which is checking that, is there anything else that you wanted to cover today? Because I'll often give the plan, today we're going to do this, this and this. Is there anything else you wanted to do today? Is there anything else you want to look at today? The amount of times I'm surprised at what people say. I'm like, oh, I didn't realise that was going to be an important thing. But, that's why we ask those questions, in order to get full understanding of someone's expectations for the session.
Yeah, 100%. One of the another idea that might be helpful in terms of like finding your own feet is this, like Carl Jung had this idea of, through the first 30 years ish of our life, we accumulate experience, and then beyond that, our task is to become more like ourselves. And that's like, again, I think that sounds simple, but maybe isn't. But he described this process of circumambulation, which is like a circling that gets closer to the center. And so as we move through our life, our task is to notice what gives us energy, what kind of takes it away, what feels right, what doesn't feel right. But often when people come to therapy, what they're trying to do is discern, actually, is this something that doesn't feel right, or is it something else that's going on? But when I think about the physios that I've worked with over time, I think I've worked with some really great physios. I don't know if it'd be useful to say who they are or not, but I guess the ones that come to mind are James Moore, who I worked with probably like 14 years ago, and Alison Rose when I moved up to Leeds. And James and Ali are, in my mind, like their approach was very different, and their interpersonal approach was very different, in terms of like what it was like to kind of chat to them, and their technical approach was very different, actually. Yeah, it was all different, but equally as valuable. And that kind of continued with like the physio side since then. But I think James and Ali, because that was early days of me trying to get through a chronic hip injury, really stood out to me. And I guess they'd found their ways of being more like themselves in their work and being very effective at it too, as I see it anyway. I don't know if they'd agree or not.
I don't know Alison, but I know James Moore very well. He's been in lots of different roles, ranging from sports, running London clinics and presenting. So he was a very effective clinician from what I understand. I haven't worked with him, but I've seen him on stage. Very, very knowledgeable. What do you think the clinician could take away from today's session and implement tomorrow? If there was a few points for them to think about to really implement tomorrow, what do you think that could be?
I think the things that I would emphasize is that you probably already have enough, and in some ways the task is to figure out how to become like yourself in your work. And when you do learn things, to figure out how to integrate those. And so using the approaches that we said about kind of reflecting, maybe even writing about that and drawing models together of like, okay, when I do this, I'm doing this. So I think if you can consolidate those aspects of your practice, I think that could be really useful. Alongside that, and this is, I guess, where it becomes a little bit almost potentially antithetical, being open to new ideas and ways of doing things, and maybe the techniques and approaches that we've discussed, if they feel unfamiliar and resonate, then having a Google, seeing what it's like, trying out some questioning. There's loads of examples. You can ask a chatbot, give me 10 questions in the style of this, or this. If I was going to do this in this way, what would I say? And just try them out, see if it resonates, see if you can find your way of using those words. And kind of, be someone who feels like they're enough and also is willing to adapt and kind of change moving forward. And think about how much of yourself you want to bring into the work and the importance of relationships. Like, those are the big 3 standouts for me.
And on that note of changing, adapting, and bringing the self forwards, we're going to try something different here. We're going to hand over the hosting to you, Steve. You're going to interview me, just to give the listeners an idea about how you would question someone and how you get some interesting dialogue through from it. And we'll over to you, Steve. You take the lead.
No pressure. I've really enjoyed hearing about some of your experiences and practice, because it's not often that I get so much time to talk to somebody about how they approach their work, especially a non-psychologist. Usually I speak a lot with psychologists about it because we like talking about things. But I wanted to, I suppose I was going to ask you a question, and then in your talking about it, maybe respond how I think I would respond typically, but perhaps also leaning on some of the things that we've discussed, so that it hopefully will be useful for the viewers in terms of seeing how some of this might shift a conversation. And the question I wanted to ask is maybe on the surface fairly simple one, which is how did you come to do the work that you do, Charlie?
The first thoughts I would have been having around what I wanted to do with my life was probably around my teenage years. I remember as a teenager not quite knowing what I wanted to do. There was thoughts around the military. There was thoughts around working in sports. Always loved sports, so I always had a passion for being involved in it, and knew from a young age I wasn't ever going to make it as an elite sports person. So how else do I then find a way in? And then as a college student, I had careers discussions with people who put me off. In fact, maybe it was kind of GCSE, who put me off physiotherapy as a primary aim, even though I was slightly interested in it, because I remember watching Arsenal as an Arsenal fan, and seeing Gary Lewin, who was the then physio of Arsenal, thinking, maybe that's the way I do it. I quite like the body. I quite like understanding about the human body. I quite like helping people. That looks an interesting thing. Maybe it's that. And then people around the careers conversations said, it's really tough to get into. You'd have to get really good grades. And probably because I was young, that was quite. I was quite impressionable to that. I thought, maybe I'm not quite academic enough to do that. So I went off to college and did subjects I liked. I did biology, psychology, and PE. And I was convinced to do maths, because I was quite good at maths. I was convinced to do maths, even though I didn't really want to do it. So I did maths at AS level. And because I'd been put off physiotherapy in GCSE times, I was then thinking, well, I'm good at sport. I like sport. I'm good at science. Quite like science. Put them together. Sport science. Great. There's a university degree for that. Mm-hmm. So I'll go and do that. Mm-hmm. didn't really push myself or put as much effort as perhaps I could have done in college. So my grades were kind of average. Although interestingly, I did get 1A and it was in psychology. So that was always the one that I was really interested in. Like PE was just fun because it was just play for me. But psychology was always the thing that grabbed my attention when I was at college. So perhaps tried a bit harder and engaged in that a bit more. Went off and did my sports science degree. Enjoyed that and actually figured out that I could knuckle down and work hard, and was rewarded with good grades in that too. But at the end of it was a bit lost again. Is sports science really a career for me? I wasn't quite sure. It didn't quite feel right. Perhaps it felt like I'm not sure. I really, at that point in time, I'm not sure why, but it just didn't feel like the career for me. And then I found out that there was an MSc for physiotherapy at the university I went to. So I looked into it, realised that you could become a physiotherapist in 2 years if you did the MSc, this pre-registration accelerated course. And it came back to me at that point. It's like, actually, that person who told me I needed good grades for it, well, now I've got good grades. You know, I got a first in my degree. They rounded up from 69.6. They rounded up very kindly. But I got a first nonetheless. I thought, yeah, why not? Why can't I go and do that? And there was just this fire that kind of almost lit within me of like, that is the thing I want to do. I do want to help people. I do want to be in sport. I can be a sports physio. That makes sense. I'll do the course. So I did the MSc in physio, which was definitely the hardest study I've ever done, but very much worth it.
Yeah, thanks for sharing that. You know, it made me think when you were describing about going through college and picking A levels, I was like, oh, like that's basically the A levels that I had. And I also thought about being a physio or doing sports science or psychology. So as you were talking, I was like, yeah, I was kind of like back in my own kind of journey of experiencing that. I was, you mentioned a couple of times about being unsure and about being lost along the way, and I wondered what that was like for you at the time.
When I was growing up, my parents were always very accepting and very relaxed about whatever I wanted to do. My mum in particular, she always just seemed to have this confidence that I'd be fine. Yeah, you'll be okay. You'll do all right. And when I was choosing the secondary school, there was a secondary school that was really well renowned in our area, and they interviewed you. And she said, "Oh, do you want to go to this school?" And I was like, "Oh no, that sounds." At that time, I was much more shy than I am now. Oh no, that sounds like a terrible thing. I would hate that. I don't want to go to that. Okay, no problem. We'll go to the other school. And I went to the other school, which was also a good school, by the way. But I just remember her being very comfortable with me choosing my own path and my own destination. And even throughout school, if I didn't do my homework, there was never any pressure. Like it was up to me, and I would just find my own way. Never any trouble. But I also think that I could have done with a little bit of that pressure. I think I could have done with a bit of nudging, and perhaps people might be listening thinking, well, you did it right in the end and you found your way. But I also wonder, perhaps there was even more capability that could have been unlocked, even more potential that could have been unlocked with a little bit of kind of gentle coaching and nudging in the right direction from parents. But ultimately it was a very safe and loving environment that I was in that allowed me to find my own path for sure. But I guess that when I say feeling lost, it's because of perhaps I didn't quite have someone there with some wisdom to kind of support that decision making. It was me very much figuring out this stuff on my own. You know, no one in my family had been to university, so they didn't necessarily have much reflection to give. You know, my dad left school before GCSEs. My mum didn't have a very enjoyable experience at school either, and it wasn't a very good school. So once I was past school, it was kind of completely new for the entire family. So I think it was no wonder they didn't necessarily have much guidance to give, because it was new for them too. So I think that feeling of being lost was probably not just me. It was probably all of us thinking, well, you know, what is this world? What do we do here? How do we guide this? How do we facilitate it?
Yeah. Maybe every everyone was a bit lost. Yeah. Also can't help but notice the personal resonance of I was in a maybe similar but different situation of being the first one to go to uni, and I never met a psychologist till I started working in a service that has psychologists in them, and kind of finding one's own way in that. I guess I'm imagining the image that I often had when I think back to that, and I don't know if it fits with you or not. I sometimes think that like everything I kind of learned was like a new thing. I was like, okay, there's a thing here that's visible that wasn't visible before, and oh yeah, there's like this course that you have to do, and oh, that's where people work, and oh yeah, there's a master's, and then you can do this, and but it all felt like it was like new ground. And yeah, I guess I kind of wonder what that, with that in mind, I wonder kind of what that journey of like, well, actually, there's two questions. One is like, are you now found? And the other one is, if so, or if not, like, what's that journey been like along the way?
Well, something else you mentioned there made me think of actually quite an intense negative experience I had when I was trying to figure this stuff out and trying to find what was going to be right for me. I went along to a military conversation, a military interview, I guess. Maybe not interview. I was maybe 15, something like that, and I definitely started to be curious about that route. And I went to it was in London, somewhere fancy. Went with my dad, sat next to him, and this officer was sitting in front of me with badges across his shoulder, and I'm pretty sure he just said, "Hey, how are you? What brings you here today? What do you want to know?" And I froze, completely froze. My throat closed up, couldn't speak. I was just in this sudden panic mode, and I remember it calming eventually, but this real intense, perhaps it was shyness, perhaps it was just that I suddenly realized this wasn't for me, this wasn't the kind of thing I wanted to do. I'm not really sure, but I remember it being really intense and really tough. And we started speaking in the end. I don't remember anything about the conversation, but I left that and never thought of the military again. You know, that was never part of my journey anymore. So perhaps that intensely negative experience did go on to shape me and point me in a direction that helped me to find what was my purpose. When I explored different avenues within physio, I've had lots of different types of job. I've had sports physio roles, I've had occupational physiotherapy roles, I've had desk assessment roles, ergonomic roles, I've had musculoskeletal roles in various different environments, different clinics. I've worked in elite sport, I've worked in amateur sport, and now it's this role that I'm currently in now is the first time where I can fully see my future. I think all the other job roles I knew were stepping stones for me. They were ways of becoming the best physio I could be. They were ways of learning how to be improving upon myself. None of them ever felt permanent. Whereas this, where I am now, I can't see myself ever not being a physiotherapy business owner, or maybe let's take away the physiotherapy, a business owner, because it gives me the freedom to express myself in lots of different ways, to be creative, to impart upon my beliefs and my knowledge through my business onto many people and help as many people as I can. So yeah, these last few years have been really powerful for me, realizing that even if this business doesn't work, then business ownership or the entrepreneurial life really suits me, really fits with me.
When you went, I'm really struck by what you described, that experience with the officer. Like, what age were you around that?
I think I was around 15, 14, something in my mid-teens.
Yeah. I think sometimes I imagine that to be an age where we feel like we're old, but actually we're still babies, right?
Yeah.
What do you think that version of you would make of you now?
I don't. I always knew that I was introverted and shy when I was young, and at primary school I remember thinking, I'm not going to make it in this world if I continue to be this shy. I need to figure this out. So from that point onwards, I was working on some level of extroverted skill, and now feel pretty comfortable to wear to wear that the majority of my life, when I sense that it's the right version of me for my job and for my responsibilities. But that there is still this need for me to recover, and this need for me to, if I've done a lot of this, for example, podcasting, if I've done a lot of time facing doing patient sessions and lots of meetings, then I need to recharge. It doesn't energize me the way I know that it can energize other people. Certainly if I do lots of it anyway. So that was definitely something I was aware of young, and was clearly on like, that's quite a steep learning curve for that. And I remember it. Yeah, I guess university is a pretty important time as well, isn't it? Because you're suddenly away from home for the first time and meeting lots of new people. And if I think of those time points there, late primary school, when I suddenly realised I was very shy. My teenage years, where I started to learn that I could actually be a bit extroverted and do quite well socially, but still struggle when confronted with a very important, certainly in my perspective at that age, very important senior person within the military, and completely freeze. And then fast forward another few years at university, being really comfortable socially at that point and being more confident in my own skin.
Yeah.
And then if we go again, actually, through my career, being trusted with leadership roles, or like as a teenager, I was made the captain of a football team, and then I was given a leadership role, a management role, relatively early in my physio career as well. So these checkpoints almost were affirmatory for that, of like, you know what, you can do this more extroverted side of you. You can lead, you can manage, you can be at the forefront of some things and do well and perform well.
Yeah, maybe a similar but different question. Thinking about that even younger version of you who was in primary school and realizing that he was shy or introverted, and like, what do you think he would make of what you've gone on to do?
I think he'd look at that person and think, that's the kind of person I'd want to be, actually. Yeah. I never necessarily saw myself in a specific role, certainly not that young, like a specific job, but I would imagine it would be looking up positively at a role model, perhaps. So yeah, I'm pretty proud of where I am now, pretty happy with my life and the things that I do and the way that I can help people and the impact that I can have. I've got a happy family at home, and yeah, I think he'd be looking up aspirationally at that version.
How is it to, I don't know if you routinely think about these aspects of yourself, but let's assume that most people don't. I wondered, like, what is it like to think about that and, connect with that idea of your younger self being, maybe my word, but proud,
My son is 8 now, so he's around the age where I'm recalling back to. So I would hope that he would look at me with that as well. Look at me as a role model for him, and that also inspires me to do what I do and be the way I am. It also prompted me a few years back, when I was working in sport a lot and away a lot, to reflect on, is that the right lifestyle that helps facilitate that parent-child relationship in order to support them the way that they deserve. So yeah, I stepped back from some of the sports work, partly related to create more time for that. As to whether I do that kind of reflective work very often, no, I wouldn't say I do. I sometimes think back to that. And I mentioned it on this podcast before about the introverted reflection, realizing that I was shy and wanting to work through that to learn extroversion as a skill. I wasn't thinking in that language at the time, but I was certainly aware that I didn't want to be as shy as I was. But I don't know if I've necessarily connected the emotion of pride to my present self.
Yeah. There's about 1,000 questions that I potentially want to ask, and it's always hard to know how to do justice to this sort of thing in such a short amount of time. But I was wondering, from your perspective, if there's anything else about how it is that you've come to do what you do that is missing that would be important to talk more about.
I think some of the things I've realised with my recent ambitions is that this idea of a pebble dropping into the pond and this ripple effect coming out, me being the pebble dropping in and being able to have more impact on more people and helping more people to either engage in physio coaching perhaps, or whether they have a complex problem that needs to be solved and it isn't me that's helping them, it's someone from my team. Being able to have that ripple effect over more people, that's been something that's become increasingly part of my ambitions. So it used to be almost about me, how can I be the best physio I can be? Now it's how can I have the most impact on others to help more people in this world. So I think that's what's shifted in recent times, perhaps even prompted me to think about business ownership seriously, whereas before it was always what's the company that I can work at in order to continue learning. And now it's like how do I create something that can help the most people I can help.
Yeah, help the most people you can help. Yeah, I was thinking about all the different people that you've spoken about in this part of the conversation, about the people around you growing up, and you mentioned your son, right? Yeah, the pebble in the pond, and I guess they're the closest to the pebble, right? In some ways, family.
Yeah, and I have a daughter as well who's 4, and she needs a very different version of me, actually. And that's something I've reflected on in recent times, that my son probably looks at me more as a role model, as like, wanting to be physically active and enjoy sport, and he's kind of growing up almost not carbon copy, but very similarly to me. He seems to have very similar interests. My daughter has different interests, and she probably needs me more as kind of a safety blanket, someone there to kind of support her through her life and be there for her, rather than necessarily, I don't think she would look at me as a role model per se, but she needs a different version of me. That's been an interesting reflection. So if you think about the closest part of that pebble drop, we mentioned chameleon earlier, the parenting chameleon as well. Which version of me is needed for my daughter versus needed for my son?
Yeah. I definitely want to ask more about that. I'm also aware that, we could probably spend the next hour in different parts of this conversation. And I mean, I guess I notice like curiosity around the different people and kind of what their experiences are and what they might have made of these different things that you've done, and how they might have felt the ripples knowingly or unknowingly. And I also wonder about like future aspirations that you might have and how that fits with that, and loads of like potential directions. And I'm not sure like at this point whether it feels like an okay point to pause this part of the conversation, or whether these things that I'm curious about feel important to talk more about. Like where are you at?
I think we could look into the future for sure as a sort of finishing point for today's episode. The future involves helping, continuing with my mission from to build this business that I'm building to help more people, to continue spending the time with my children in order to help them feel comfortable in their own skin and live the life that they want to live, and to be a parent as much as a business owner for sure, to be a friend. I've heard people kick back on this idea of balance. I think that's true. I think that work-life balance is never a fixed point. It is an integration. A cost benefit calculation, as someone referenced in a few episodes ago. To just be constantly aware that for every choice I make has an action, has a ripple effect, and to continue reflecting upon those choices to make better choices within my own life and within my own business and within my own family environment. That's where what better never ends means for me at this very moment. I asked that question of our guests, and I asked that question of you last time. So finishing up things here, I'd like to thank you actually for coming back again and offering a different perspective on questions. There's a lot that people can take away and reflect upon. I actually quite enjoyed that sharing process, and it felt very natural. I think that many people would hopefully hear a vulnerable side to that. I was trying to be very open and considerate of what I was trying to share. Do you have any final reflections that you'd like to share as well?
Thanks for sharing what you did in response to the question of how you came to do what you do. And I noticed lots of resonance, and I was kind of mindful. I guess I had a part of me that was in the conversation, a part that was observing it, to refer back to that earlier idea and thinking about, this is recorded. And so sometimes when I do this without recording, I might ask questions that move even closer to vulnerable parts. Potentially, it's hard to know because I don't know that, but but as you spoke, I noticed lots of resonance. I was thinking about, from a teaching perspective, how there wasn't much motivational interviewing because you didn't come with a problem. And so the conversation would have been different if I said, hey Charlie, what's the problem you're facing at the moment? Then I might have been able to ask a bit more in those ways that we discussed, where you kind of inquire more about how you might understand it or make sense of it differently. I think there were parts of appreciative listening where I was kind of using your words. There was some active listening where I was kind of reframing things a little bit, and I was self-disclosing, kind of naming some of my process too. So hopefully people see that, or can see it if they watch back. And hopefully that's useful. But yeah, I'm really, grateful for hearing more about you. I think I would know, thinking a bit about this idea of relationship, I'd say after the last podcast, just before we came on air, I said that I kind of went away being well, that's a lot harder than I thought it would be, because it feels like there's a lot of pressure on. But I also felt through that process I'd spoken a lot about me, but I didn't know much about you. In this conversation, even before we got to me asking about you for however long it's been, I felt like I did know more about you, and I was thinking actually that feels a lot more kind of comfortable, with this idea of things that are worthwhile being based in relationships. So yeah, I'm kind of going away with that, thinking about that, and grateful for the opportunity to talk again. So thank you.
Thanks, Steve. And the listeners would love to hear how to get in touch with you and to learn more about you.
Yeah, so any and every way is on my website, which is the best place. So it's drstevemeyers.com. It's got links to Instagram and how to book in for therapy. And if anyone did ever want to talk more about these ideas from a supervision perspective, and kind of book in to have more of a chat about how they can integrate it, or they want a therapy or know clients who want therapy, I'm around for all that. I also work a bit with pro athletes, cyclists. So yeah, all of that is on there. And any questions, please reach out, let me know.
And the listeners and watchers that have made it this far, if you could leave us a review. We are trying to reach more people that enjoy these episodes just like you, and the reviews are really powerful for that. So Steve, thanks for coming in. Really appreciate your time. And who knows, maybe a third episode.
Sounds good.
Thank you. Thanks for listening to today's podcast. This podcast is sponsored by Better, provider of health and wellness services in central London. We really believe that we can help people feel better and live better. You can book in for face-to-face services at any of our 3 London clinics. We have one in Marylebone, one in Soho, and one in the city. You can also follow us on Instagram at BetterNeverEnds, or head over to our website for more information about the clinics or the podcast at www.betterneverends.com.